17, but expected to be 70.15 billion by 2023. And that is
So you can, so you can please start, sir. Sinha, sir, you can please start, sir. Yeah, you take this. So you can, Sinha, sir, we are able to. Sir, you can please explain. That mute is there. Hello, sir. Are you able to hear me, sir?
now you can hear me.
Yes,
Yes,
sir.
sir. Yes, sir, we can hear you, sir.
Okay, okay. Let me.
Yeah. Okay, sir.
Okay. Now you can see the screen. Okay.
Yes, sir, we are able to observe the slides. We
Okay,
are able to
thank you,
observe the
thank
slides.
you. So actually, it was a disconnected from due to some network reason, and
Yes, sir.
really, I'm sorry for that. But I was just telling you about the importance of the novel drug delivery system with reference to the compliance and efficacy, as well as the business to the pharmaceutical houses. And uh, as you can understand from the slide itself, that the 70.15 billion will be the market by 2023 for the novel controlled drug delivery system. And that is the reason why each and every pharmaceutical giants, they are trying to develop some innovative technology in order to improve the delivery of certain bioactives. And beauty of this particular system is that you can develop a system which can extend the duration of the action of a drug for 24 hours, even for 7 days, months, or several months, ranging to years also. That is the beauty of the controlled drug delivery system. If you compare with a conventional system, in the conventional system, if after giving a drug, it is absorbed and the duration of action is very short, and that leads to the repetition of the dose several times in a single day. Certainly, it will depend on many other factors, but that is very inconvenient, as well as sometimes very, you can get the peak and valleys, fluctuations in the blood drug levels. So to avoid such things, the novel drug delivery systems were visualized to extend the duration of action. And in that extent, for the extension of the duration of action, the extended release, sustained release, or prolonged release terminologies came into the picture. But actually, the controlled drug delivery system not only extends the duration, but also controls the way by which the drug is being released. This particular novel drug delivery system approach can be applied to almost all the routes of the drug delivery, which is utilized for giving the bioactives or the APIs to the for a particular purpose. I will be dealing one by one, and I will start with the ocular drug delivery, how the NDDS system has been exploited in the ocular drug delivery system. As you can understand, the ocular drug delivery system, we try to give the medication in the form of the ointments or eye drop, preferably eye drops, and that is in the eyelid sac, which we call it as the cul-de-sac, and that drug get a very little time so that the drug can cross the cornea and enters into the deeper chamber of the eye. And if you see the eye, it is having the anterior chamber and the posterior chamber, and reaching the drug to the posterior chamber is certainly a challenge. Even giving the drug to the anterior chamber has certain concern with us. I will take one of the case of the glaucoma, which is a normal, in Hindi we call it as the Kala Motia, and around 2% population suffer from this particular disease, where there is a sudden rise into the intraocular pressure. And this increase in the intraocular pressure exert pressure on the posterior chamber, and that leads to the degeneration of the nerves. And if it is uncured, then untreated, then certainly that may lead to the blindness to the patient. And it is one of the major reason for the blindness of the person. There is no particular cure for this particular disease, but still it can be managed so that the further damage to the should not be should not progress. And the first line therapy which the doctor uses a eye drop solution that is of the pilocarpine 4% in order to decrease the intraocular pressure. And what happens if it is given, you see the doses regimen which is prescribed by the doctor. 1 to 2 drops every 5 minutes. That means you are giving 5 doses at one time. Then after that, it is advised that every 5 minutes, you have to take a drop for half an hour. And then for every 15 minutes for 1.5 hours. That means during a span of over 2 hours, you are administering 17 doses to the patient. So this is a very high dose which is given to the pressure to the patient in order to reduce the intraocular pressure. If it doesn't work, then this same therapy is repeated. So this is how we see the wastage of the drug in the conventional therapy. And as you can see, the eye drops, they have certain limitations. As soon as it is being instilled, the volume which can be accommodated into the cul-de-sac is very less. And most of the drug, they are washed off due to the gravity. They are diluted due to this reflux tear generation, and a huge part of the drug is also wasted due to the nasolacrimal drainage also. So sometime around only 2 to 3% of the administered drug is actually available for the absorption. So this is the conventional therapy. Now, how to improve this particular therapy by using certain novel approaches, and that was visualized by the ELSA Corporation, and they developed the Ocular system uh, for of the pilocarpine. And you see the beauty of this particular system. It is a reservoir of the drug in alginic acid, and it is sandwiched between two rate controlling membrane, and there is an annular ring of titanium dioxide so that the patch can be well visualized by the patient, and it can be placed exactly into the eye cavity. So this is how the approach was designed, and this development led to a, a small insert which can be fixed on the sclera of the eye, and single pilocarpine patch or insert, they can continuously deliver the drug for 7 days for the treatment of the glaucoma. Now you can compare with the conventional therapy where in a short span of around 2 hours, 17 administrations were advised to the patient. But same or rather better benefit can be achieved just by single Ocular's, and that too for a continuously 7 days period. So that is the beauty of the NDDS, and how it can, and you can see a great increase in the patient compliance as well as the improved efficacy of the therapy also. But still, the patient psychology has also to be valued. Still, the eye drops, they are very, very popular. And since eye drop, they are having very less viscosity, so their residence time on the eyeball is very less, and that warrants the repeated administration. Now, how we can overcome this? This can be done by using Nc2 gel, or rather we can call it as the gel-free gel-free systems, which can increase the viscosity when they comes into contact with the eyeball. Why it is important? Because if the eye drop solution is viscous by itself, then it will create a lot of problem during the formulation itself. Because mostly we try to, we can go for the terminal sterilization, but in most places we require the sterilization by filtration. So filtering a very viscous solution, again, it will be a challenge. Even autoclaving in a terminal stage, that can also lead to change in the viscosity of the system. So it is better to have a system which have lower viscosity, so that it can be easily processed at the industrial scale. But as soon as it is administered into the eye, due to some triggering factor, it for transform into the gel. And that triggering factor may be ions, that may be pH, that may be temperature, or that may be enzyme. So you have to identify a smart polymer, so that those polymers can form a gel as soon as they come in contact with the eyeball. And that was the technology utilized for the timolol, another drug which is used for the treatment of for the increased in intraocular pressure. And it was observed that a single drop of the timolol containing gallium gum, which can form the gel in situ, they extended the benefit from 12 hours to 24 hours. That means the a single eye drop administration of this gel, in situ gel, can provide the similar benefit. So again, the compliance as well as the efficacy of the system has been improved a lot. The ocular system also requires certain more innovation, especially this happens when it was given some eye drop solutions are to be administered by the Russian cosmonauts in a weightlessness condition. You can understand how difficult it will be to administer a eye drop, especially when in this space. So what they designed a wafer of acrylamide and vinyl pyrrolidine and ethyl acrylate. And this wafer was very easily can be placed in on the eye, and it softened within 10 to 15 seconds. Assume the curved configuration of the globe, and during the following 10 to 15 minutes, the film turns into the viscous polymer mass. And thereafter, in 30 to 60 minutes, it becomes a polymeric solution. So this soluble ocular drug insert provided the solution for the Russian cosmonauts who have to administer the drugs in the space. And this technology is also being utilized in our current populations also, and Lecrisert is one of them. Lecrisert is nothing but it is a polymer containing a pellet, that is the hydroxypropyl cellulose, and it is for the treatment of the dry eye syndrome. And in the dry eye syndrome, the patient usually have a problem in the blinking, or it will be a painful blinking due to less tear generation, etc. And that is the reason why so many refresh tear and other systems, they are prescribed nowadays to general public. Normally, if you take a viscous system containing the HPMC in the solution form, several administrations are required for the
Sir,
treatment.
excuse me, sir.
Yeah.
Sir, the slides are not changing, sir. Can you see, sir?
Is it changing?
No, sir. No, it's not changing, sir.
You cannot see the slides?
Sir, we are seeing just slide number 3.
Can you see the slide or not right now? No.
The screen is visible, sir, but slides are not changing, sir.
I don't know, but should I share it again?
Yes, sir. Yes, sir.
ठीक है थोड़ा सा यार कल ही हम चाबी दे देंगे यूज कराना है उसमें आप में से कोई करना चाहता है तो
Can you see the slides now? Is it changing or not?
No, sir.
You are not getting it. Let me check.
Also, we are able to see the slides.
Just wait.
Yes, sir. Yes, sir. Slide is changing, sir.
Okay, sir, we are able to see the slides.
Should I send some other link?
No, sir. Now it is visible, sir. Now it is in.
Okay, so you can explain, sir. We are able to observe the slides, sir, on the Ocular.
Can you see the slides and is it changing or not?
Yes, sir, you can please explain, sir. It's all right. We are able to observe all the slides. Yes, sir.
Yes, sir.
Is it visible
Yes, sir.
and it is changing also?
Yes, sir. Yes, sir. Yes, sir.
Okay, I will just move forward because I was talking about these soluble ocular inserts, and this was actually for the Russian cosmonauts, where a insert which is in the form of a wafer is applied to the eye, which softens within 10 to 15 seconds and turns into a viscous gel within 10 to 15 minutes, and then finally into a polymeric solution covering the whole eyeball, and that too for a considerably longer period of time. So similarly, where this eye drop solution doesn't work, we can use the inserts or polymeric pellets of the hydroxypropyl cellulose, which is again a polymer, which again it can be pushed into the conjunctiva, and where it softens due to the absorption of the tear, and finally it again forms a layer over the eye. So this particular systems can be used where the eye drop solution is not sufficient to treat the dry eye syndrome. As I was talking, it is very difficult to cross the a drug to cross the cornea, and even if it crosses, it can reach to the aqueous humor, but it is difficult for a drug to reach into the posterior chamber of the eye, that is the vitreous humor. And sometimes the drugs, the diseases like virals, keratitis, or even viral diseases, or even the anti-cancer drugs, they are warranted to reach into the posterior chamber, then certainly the implantation of the drug can be done in the novel form. If you see implant, it is a sterile system, and with vitreosert, which is shown on your on the slide on the screen, it contains the drug ganciclovir, which is an anti-viral drug, and having two polymeric rate retardant, that is the polyvinyl alcohol and ethylene vinyl acetate copolymer coating. So they can be surgically implanted into the vitreous cavity, and they can provide the drug release for 5 to 8 months. So again, you can observe how this particular systems can be utilized into the treatment of the certain diseases like antivirus, as well as the anti-neoplastic drugs can be targeted to the posterior chamber. The next route, which is very popular, is the transdermal route. As you know, the transdermal route has the biggest advantage that it is non-invasive, as well as it bypass the first pass metabolism, which is not possible through the oral administration. The transdermal route, because of the large surface area present, it is very, very popular also. as the skin is the largest organ, but the largest barrier for the drug entry is the stratum corneum. And if a drug passes through the stratum corneum, that is the rate limiting step, then certainly it can pass through the viable epidermis followed by dermis, and then it can reach into the blood capillaries through the hypodermis system. So the transdermal systems are well exploited because of these reasons, because they avoid the fluctuations. A short T half-life drugs can be easily given, and in case of any toxicity, it can be removed, and it is a needle-free way of giving the medication at the same time. But certainly, it is it warrants certain requirement, a physicochemical property for a API, then only they can be selected as a drug candidate for the for a transdermal drug delivery system. Many systems have been developed and marketed. Nitroglycerin is one of them, and again it is for the treatment of the angina pectoris, and a single patch of the drug, which may be in the form of the reservoir, which may be in the form of a micro reservoir, as in case of the nitro disc, and here it is nitroder, and it may be in the form of the membrane permeation controlled system, so that the drug can be easily given through a patch for 24 hours. Why we are emphasizing on the patch? Earlier, these nitroglycerin ointments were available in the tubes, and the patient was applied a applicator sheet to apply on the chest in the case of the angina pain. But how much of the dose the patient is taking, and how much is the thickness of the ointment he is applying on the applicator sheet, and how much pressure he is applying to fix that particular applicator sheet on the chest, all are variable from patient to patient, and that can lead to the variability in the drug blood levels also. In order to avoid, it is very important to define the dose, define the surface area, and certainly controlling the rate through a rate controlling membrane, and that was the purpose of the transdermal patches. Nitroglycerin patches, again, it is a once a day preparation for the cessation of the smoking. It is a nicotine patch. It can be applied on the upper torso or upper arm, so that it can provide the benefit for 24 hours. Motion sickness is very common. Many people who travel by train, plane, or by other routes, they see the different, they feel the motion sickness, and for treatment of the motion sickness, a patch just placed around the before the ear, they can provide the similar systemic benefit for 3 days continuously. Number of patches, they are available. Estradiol patches, again for the treatment of the different hormonal therapy. The
Excuse me,
clonidine.
sir.
Yes.
Sir,
Again,
the slides are not changing, sir.
I am really sorry for that. Should I send a link of different? Because here it is changing. I don't know why it is not changing. Even I can see your now you can see.
Yes, sir. Yes, sir.
I don't know, really, I'm extremely sorry why it is not changing, but I cannot control. It is, I think the link is being discontinued in between.
Sir, it is not presentation mode, sir. It is normal view only.
Now it is presentation mode.
No, sir.
No, sir, it is not attached like presentation mode. It is general PowerPoint slide, it is visible. Please press F5, sir, otherwise.
No, it is F5. I have pressed F5 and it is on my whole screen.
Otherwise,
Should I send just a moment? Should I send a link on Google Meet? Should I
You can share again, otherwise, sir,
I have shared again. I have
screen share, you can share again.
See, I have selected this one. And it is already there. You are sharing your screen. It is, you can see, can you see the screen?
Yes, sir, scopolamine and patch.
Yes, sir, it is normal PowerPoint view only, it is visible.
No, see, at present it is normal, but now I have pressed F5. Now it is on.
No, sir, it is shared.
Anand, sir.
So you,
It is on the full screen. I don't know.
you can continue in normal mode, sir, otherwise.
I have just because I have pressed F5 and it is showing that it is please move this window away from shared application. I don't know. Let me.
You can continue in normal mode, sir, otherwise. It is visible.
But still someone is telling that slides are not moving. Can you see the
In presentation mode, it is not changing, sir. In normal view, it is changing.
So should I change into the normal view?
Yes, sir. Now it is 23rd slide.
Yeah, I can see that slide, but once I press the F5, it is on full screen, but you are telling that it is not visible to you. Okay. There might be some, should I share on Google Meet or so? Or should I continue?
You can continue, sir.
I think I should continue because already I have taken half an hour. So I was just telling the importance of the skin route for delivery of the drug and the transdermal patches, which got a wide acceptance in our pharmaceutical industry, and many transdermal patches were developed, ranging from the nitroglycerin, nicotine, the scopolamine, estradiol, clonidine for the treatment of hypertension. And there are so many patches you will see in the market. Now, basically, these patches has certain limitation that each and every drug cannot be given through the transdermal route. Especially, it requires certain dose connection, a dose related system, as well as it requires certain physicochemical property, especially the log P value of 3. Then only we can take a drug candidate for the transdermal permeation. Now, there are certain difficult molecules which also warrants to be delivered through the transdermal route. And then we have to use certain other way of delivering the drug through the skin. And iontophoresis is one of them. And this is the a system, ionosis, which is used for delivering a drug fentanyl. And this is a system where a battery operated system having anode and cathode, and the drug, according to the, depending upon their charges, they are placed. And with the help of this particular small current, that drug is forced to enter into the skin. The system can be used as a as it has ability to provide the the personalized medication, and whenever the patient warrants the need of this particular system, they can switch on or switch off the system with the doctor's advice. The nowadays, since last 2 decades, everyone is talking of the micro needle patches, and again, it is a revolution in the transdermal drug delivery system. It is a patch covered with micro needles, and they can penetrate into the stratum corneum to the depth where the nerve endings are not present. So they can penetrate the stratum corneum, but not enough to come in contact with the nerve ending. And there, this can be utilized for delivery of the difficult molecule, whether it is a protein, peptide, or it is very well popular for the vaccine drug delivery. Not many research is going on. So microneedle technology can result in more effective contact of vaccine with the antigen presenting Langerhans cells, which lies just beneath the stratum corneum. So this is how this technology is utilized, or rather transdermal route is utilized to deliver the drug in a novel fashion. But still, whatsoever system which we have discussed so far, no system can provide the benefit of long delivery beyond few weeks. Maximum we have seen 7 days or so. But if a drug is designed to be delivered through the implantation system, certainly we can deliver the drug for even for few months, ranging to several years also. So implantation system is a subdermal implant or a subcutaneous implant which can be surgically implanted beneath the skin, having a drug reservoir either present into a capsule or present into a pellet or present into a film inside the skin, and that acts as a reservoir of the drug, and that reservoir can provide the continuous delivery of the drug into the bloodstream. The NOR plant is one of the beauty of the NDDS, where depending on the number of the capsule implanted, the benefit of drug delivery can be obtained ranging from 1 year to 5 years. The norgestrol, which is the drug which is present inside a celastic membrane or silicon membrane, and it is a very simple formulation. The drug is housed inside a celastic system, capsule you can say, and sealed from the both end. And they can subdermally implanted in a Japanese fan shape, and depending on the number, you can control the duration for which the drug is required into the bloodstream. This is certainly a system where you require a small incision, and since it is made up of a non-biodegradable system, so it requires incision for insertion as well as it requires insertion after the completion of the drug release or exhaustion of the drug release from the system. So what you can observe that still the patient has a fear of a small cut, even if that cut is helping the patient for getting a benefit for a period of years, but still that fear is there. So people, the scientists thought that why can't we convert this non-biodegradable system using some biodegradable polymer to get this similar type of the benefit. And then the implantation system for evolved, where we can use the polymers like polyester polymers, PLGA, that is polylactide and glycolide copolymers. You can use PLA, you can use polyorthoesters, you can use other polyphosphazenes. So these biodegradable systems, they have excellent controlling facility, and the polyester polymers, they have got approval from the FDA, and they have been exploited for making the implantation. In this biodegradable system, only one incision is required during the insertion, but for removal, this is not required as it is absorbed during their after completion of the therapy itself. So to avoid the incision, they were developed into the rod shape, and they can also be pushed through a hypodermic needle. Certainly the gauge size is more thicker, that is the 16 gauge. And gossaryline acetate was developed in such form, and the very popular drug for treatment of the prostate cancer under the trade name of the Zoladex. And this Zoladex implant was further developed into microsphere. I will just compare that implant with the microsphere at the same time. But let us see some other very successful implants like glidal wafer. It is a implantation system for a person who is suffering from brain tumor. After removal of the brain tumor, this surgical cavity which is created, the drug containing the glidal, that is the Comstin is the drug, and that Comstin drug containing wafers, they are placed in that surgical cavity in order to provide the treatment. And certainly this was very, very beneficial for the patient. And these systems, they contain the biodegradable polymer. Another implantation system, which is also a platform technology, lot many drugs are being given using this wider implantation system. This is a Duros technology. It is based on the osmotic pressure. And if you see this particular system, this is a system where of the titanium tube, which you can say, and it contains, this is the reservoir of the titanium. And so this is totally drug impermeable. The drug exit port is this one. The reservoir of the drug is present here. There is a piston. There are two tablets of the osmogens, that is osmotically active agents like sodium chloride or other systems. And there is a polymeric membrane which controls the entry of waters or the fluid inside the system when it is implanted subdermally or subcutaneously. So depending on the fluid enter, the osmotic pressure is created. That pressure will push the piston at a very precise rate, and the drug will be out from the system into the environment. So this particular implantation system also have captured a lot of market there. I was talking of the implantation system earlier. Now let us try to compare the implant versus the depot formulation. As you have seen, the implantation system, they require a incision or injection through a bigger, thicker needles like 14 or 16 gauge needle, which may be painful. It was visualized, why don't we develop a system which form a depot on injection at the injection site, and that can release the drug for a period, considerable longer period. So biodegradable microspheres were used, and this is very, very effective way of delivering the protein and peptidal drugs through the parenteral route, and because you can understand these protein and peptidal drugs are difficult to be given orally. And you can see this, what are these microsphere? They are monolithic system containing the biodegradable polymer, maybe polyartho esters or polyesters like PLGA, polycaprolactone. Again, it is a polyester, and they contain the drug. These drugs are, their size is very precisely controlled around 10 micron, and so they can be easily injected through the hypodermic needle subcutaneously, and can provide the drug release from that reservoir, which is created at the injection site for a longer period of time. Can you see the change in the screen?
Yes, sir.
Okay.
It is 34 slide.
Okay.
Yes,
So
sir.
this is another product, another drug, octreotide, which is a synthetic peptidal hormone of the somatostatin, and and this is for used for the reduction of the tumor size. Again, it is the polylactic acid and glycolic acid monolithic system, and it can release the drug due to the polymer erosion and degradation for a period of 28 days. So otherwise, if a conventional system is to be administered, it has to be administered 3 times a day. So single injection can provide the drug release for a period of over 3 months. There is another system of microspheres. You might have heard of the Depo-Provera, that is medroxyprogesterone acetate hormone that is used for the hormone therapy, given usually to the pregnant woman or someone who suffers from fibroid. So again, that is a biodegradable type of system which can be injected, and they can provide the drug release for a period of even 3 months after a single injection. That is the important part with the biodegradable system. So now you can visualize how the different routes are exploited for different durations of action, how different routes are utilized for delivering these systems which cannot be delivered through other route. Say, for example, any drug which degrades in the liver, certainly we can prefer parenteral, transdermal, or some other routes for that. Now, in depot preparation, there is another technology, which is the Nc2 Gel Forming Technology, which earlier we saw for the Ocular system. It is also, this system can be utilized for the parenteral system, and again, polyester polymers
निर्विक
ಇನ್ನೆರಡು ದಿನ
ಏನೋ ಮೀಟಿಂಗ್ ಐತೆ.
Can you hear me and can you see the screen?
Yes, sir. Yes, sir. Sir, your voice is audible, sir, and the screen is visible, sir. Sir, you can continue, sir.
I just switched off my in order because the sometimes technology also fails. And due to some internet problem, I have just connected through my mobile. I was talking, I was just comparing between the a long-term delivery through a parent implantation system versus the depot preparation that is given through the injection of some biodegradable polymeric drug matrices. Now, the next point, which I feel that it should also be emphasized, that these certain drugs, certain in situ gelling systems, they are also very, very catching the market, because these systems, they can be easily processed. They contain some polymeric gel-based system, novel system, transform plus of pH temperature or some presence of oil or ultraviolet light. So this transformation can create a drug reservoir at the site of injection, and that can help into the prolonged drug delivery. The in situ gelling system makes
Sir,
sure
my screen is not visible.
again not visible. Now it is visible.
Yes, sir. Now it is visible, sir.
Yes, sir, visible.
Now it is visible. So then I will not go for the presentation mode. It will be just like this only. So
Okay.
main important thing we should understand that when we create a novel drug delivery system, not only the how the drug is going to behave in the body, it is also important whether it is industrially processable or not. A very high viscous material it is always difficult to process. So a low viscous material, they can be easily processed, they can easily be injected through the hypodermic needle, but the benefit can be reproduced in situ due to the some triggering factor or stimuli which can transform them into viscous form. And in this system, Artrigel, Saber, and Regel technology, they have the market, the polymer as the polylactide glycolide copolymer. It is a tri-block polymer, and it thermally reversible gel property is shown by only these polymer with particular molecular weight. So this this particular polymer has been utilized to deliver many important drugs like paclitaxel and etc. And they, as such, they transform into a reservoir after injection, and finally the drug can be released for a long time. Another important use of polymeric system of in the novel drug delivery system is the feedback mechanism. And this is one of the example where a polymeric system made up of two polymers, polymethyl methacrylic acid and polyethylene glycol, they are pH sensitive. They expand at high pH and shrink at low pH. So this is what the technology is there. Now, this is the system where the drug, the insulin, which is used for delivery of the insulin. As you can understand, the insulin delivery should be triggered by the presence of the glucose in the blood rather than giving a fixed dose to the patient. So in this particular feedback system, the drug is housed inside a membrane made up of these polymer, and these membranes, they are impregnated with the enzyme glucose oxidase, and depending on the glucose level, this glucose oxidase, they react to form the gluconic acid, and that acid formation will lower the pH, and due to lowering of the pH, this polymer shrinks, open the gate for the drug delivery of the insulin. And as long as this pH is low, this will allow the drug to move inside. But after the pH increases, as the glucose level is normal, then finally this gate will close to prevent the drug release. This is how the feedback mechanism system works. The intrauterine and intravaginal system, they have also been exploited for the novel drug delivery system. And both monolithic system, reservoir system, or micro reservoir system, they have been designed. They have been designed in the form of the vaginal rings. They are usually donut shaped drug delivery system. They can be placed into the vaginal cavity, and the fluid of the vagina, they lead to the will be released from that particular system. So basically, these particular systems, they can be used for contraception and other hormonal therapy. Intrauterine devices, they are used from ages, especially the non-medicated system like copper T, where the most of the action is due to the spermicidal action of the copper, or the mechanical action due to which the contraception was prevented. Nowadays, there is medicated system containing levonorgestrel housed inside this particular system, and it is covered with a polymer, ethylene vinyl acetate copolymer, which can govern the drug release. This is used for hormonal therapy to prevent the pregnancy, also used for the treatment of the fibroid, etc. The similar product is the Progestasert. It contains the progesterone 30 milligram. Again, the rate controlling membrane is same, ethylene vinyl acetate copolymer placed into the uterine cavity, provide 60 microgram drug release per day for a period of 1 to 2 years. So again, this provides a contraception for a period of 1 to 2 years. So these are the technology, novel technology, which have hit the market, and lot many are to venture into the market and training the critical contains and you yeah, I think I was again disconnected. Now you can
Yes,
hear,
sir. Yes, sir.
and and I was just explaining about the Kinogel system. Apart from the type of, again, internet connection is troubling me. Now this is again another intravaginal insert, dinoprostene vaginal insert, and again it is a polymeric slab system, rectangular in shape, with rounded corner contained within the pocket, and can of more than a week like so. And this particular system can be placed by the self-insertion, and the rate of the drug release is very, very precise one. I will rush to the oral drug delivery. Not, I will cover a lot. You can understand the oral drug delivery has been exploited, extended, sustained, and controlled. And few examples is present on your screen. Earlier, it was given twice a day or thrice a day tablet, but in oral system, it is difficult to control to release beyond 24 hours. And there are so many other drugs, phenyl, methylphenidate hydrochloride. Again, you can see a 3-dose repetition can be easily covered with the single dose. And this can happen either you make a reservoir system by coating the core tablet with a rate controlling membrane of any polymer, whether it is a cellulose derivative or it can be some other polymers too, or you can make a matrix of the systems at the for making a sustained system. In oral system, gastroretentive systems, they are also very prevalent. There are so many ways by which the gastroretention can be done. It is for the treatment of the local pathologies or for absorption of those drugs which do not have the absorption window in the small intestine, or they are unstable into the small intestine. An example is already given. So either you can make such system by changing the density, making the higher density system or lower density system, which can float on the in the stomach. You can make some bioadhesive system, or you can also make some unfoldable systems which are so bigger to pass easily 5 to 6 hours in the stomach, so that the drug can be completely released from there. The osmotic or OROS technology, again, it is a platform technology. More than 50 to 100 tablets are being available using this osmotic pressure. And glipizide is one of the very successful drug which has been used for delivery of the glipizide under the trade name of Glucotrol XL. And you can see that in the previous slide that there is a osmogen layer, there is a drug reservoir layer, and in body, when the drug, the fluid moves in a controlled manner, dissolve the osmogen, exert pressure, and that can lead to a very precise drug delivery through a laser-driven orifice. So again, this is one of very important technology. Many innovative thoughts have also been given, especially for treatment of the pain. And one of the innovative product is the Morphine Lollipops. So again, they are for treatment of the pains and etc. Spensule technology is not new one. It was developed 50 years back, but still this is hitting the market. You can see different color beads or spheroids prepared by spheronization and extrusion followed by externization, or by layering of the some inert spheres. The several layer of the drug can be coated on that particular system, and they can further coated with a rate controlling membrane and put inside the capsule to get a gradient type of drug release. So lot many drugs again are utilizing this particular technology to form to be delivered into the form of the pellets. Pellets can also be compressed, but certainly in those cases you have to add a high degree of plasticizer. The fast dissolving area, again in novel system, where We are developing some mouth melt tablets. We are developing some oral dispersible tablet. We are developing some oral films. Again, not many patents and products you will find in the market. And as these systems get very less time, less than they claim less than 25 seconds, but many systems they immediately dissolve. How they can dissolve? They dissolve, they are very, very porous one. And if you want to make something porous, the lifolization technique is one of the important thing. And this Zydis used this technology, lifolization technology, to make tablets which are highly porous. And once they are placed on the tongue, they immediately absorb water, and within 3 seconds it's dissolved into a liquid. So these are very fast dissolving things, and they do not require any water to administer inside the GI tract. So again, very, very important way of giving the drug. One of the product is shown on your screen, that is the loratadine. Again, this is for the allergic relief. It is a rapidly dissolving tablet. So there are so many names given there. Soft gelatin capsule is again being utilized to fill the liquid, and that liquid is a microemulsion or nanoemulsion. First of all, you must try to, these are completely different from the conventional emulsion. Please confirm, am I audible?
You are audible, sir.
Audible. So,
Audible, sir. Audible.
okay, so microemulsion and nanoemulsion. See, microemulsion is a misnomer. Microemulsion is also of the nano range, and one, they are thermodynamically as well as kinetically stable, while nanoemulsions, they are only thermodynamically not stable but kinetically stable. So they contain some lesser amount of the surfactant as compared to the microemulsion. And the cyclosporin, which is a peptide, is only drug which is given in the form of the knee oral. Okay. And this knee oral product, it is a self-emulsifying drug delivery system. It contains the microemulsion pre-concentrate, and once ingested inside the body with peristaltic movement and the fluid in the lumen, they are converted into the microemulsion. That is the beauty of this particular system. This nanoemulsions are being utilized extensively for delivery through the ocular route, also delivery to the parenteral as well as through the skin also. Colon specific drug delivery, many products, especially the drugs for treatment of the IBD, IBS or colon cancers, lot many research have been done. And here what exactly is done, the drug is prevented to be released into upper GI tract, rather they are designed to be released into the colonic region. So you have to buy time, and finally the drug should reach there. How you can do this? You can exploit the variable GI pH, or you can exploit the transit time. Say for example, the transit time of stomach is 1 to 2 hours, while the small intestine is 3 to 4 hours. So if you can prevent the drug release for 5 to 6 hours, certainly the drug will be reaching in the drug will reach in the reason, it can release that. And specific enzymes, they are glucuronidases, etc., glycosidases, so nitroreductases, so they can cleave certain bonds and lead to the drug delivery specifically to the pulmonary region. And mesalamine is one of the very successful product which is made up, which actually contain the sulfasalazine, and it is attached to sulfapyridine with a azo bond. And due to azo reductase specifically present into the colon, the bond is cleaved and the that drug is specifically, that is 5-amino salicylic acid, is specifically released into the colonic region. So this is again one of very important technology. I am reaching towards the end. This is nasal drug delivery. Again, you can understand the nasal cavity runs to around 10 to 14 centimeter, and if you are able to target your drug deeper into the turbinates, middle to upper turbinates, especially the olfactory lobes, certainly you can deliver the drug to the brain also. This particular route is also being exploited. Certainly, a nasal drop will not achieve that thing. So you have to use certain atomization system, that is mucosal atomization device, which can push the drug to deeper inside the nasal cavity. So one of very important thing. Nasal cavity is often confused with the pulmonary drug delivery. Here we are targeting the lungs. We can target the lungs by 3 particular technology, by using pulmonary MDIs, that is meter dose inhalers for asthma and for the treatment of COPD, etc. But see, this is an age-old technology. Very important that many drugs can be given this using MDIs and getting into deep into the alveoli, and there the drug is absorbed very easily. So unnecessary drug concentration is not required. A small amount can help you out. Say for example, salbutamol, normally 2 mg tablets are given to the patient of asthma, but if it is given in the form of the MDI, the dose is only 200 micrograms. So this is the beauty of this pulmonary drug delivery system. The main drawback associated with this is that it requires a coordination between actuation as well as in the inhalation. Sometimes that the children's fails, and that is the reason why we use the spacer to avoid the impactation of the drug in the throat. Otherwise, it will go inside the stomach. So we have to avoid that. So another system was developed, that is the dry powder inhalers. So we use certain devices, and due to the patient inhalation capacity, that creates turbulence in the powder, and that powder get aerosolized, and the patient can inhale that one and target to the lungs. But certainly the DPI require larger doses as compared to the pulmonary MDIs. Nebulizers, you can understand, again, it is very easy, where some liquid systems can be broken under pressure, and that can be converted into the mist, and the small kids, they can take under the normal breathing process, so they can avoid the drawbacks of the MDIs and the DPIs at the same time. This is very much important for especially the patient who are pediatrics or they are geriatrics. Both have difficulty in this using upper 2 systems. So this can be done. The importance of the inhalation therapy, this is the only route through which a product came into the market for the insulin. Otherwise, people are still trying to deliver the insulin apart from the subcutaneous cutaneous route. So it is very important that non-invasive route should be exploited in a way so that such systems, some difficult molecules can also be delivered. So Exubera was one of the systems which was launched by the Pfizer, and it was the first inhalation insulin, although it was withdrawn from the market because of the poor response from the patient, what the company says, but there was certain other issues also. But this was the first inhalation insulin. After that, mankind also got an approval for such system. So this is what we can imagine any route, any system, and you can try to transform them into a novel system. Certainly, the novel system, they are costly. One thing you should understand, they cannot completely substitute the immediate release system. Again, this must be understood. So these systems should be researched only to provide a better efficacy and better compliance to the patient. So with these words, I am sorry that there were so many hitches due to some technical reasons. And again, I thanks the organizers for giving me an opportunity to present myself. Thank you.
Thank you, sir, for sharing your thoughts. I thank our guest speaker, Dr. V.R. Sinha, sir, for throwing light on recent trends in novel drug delivery approaches for improved compliance and efficacy. Your thoughts have enlightened our minds. Thank you, sir, for adorning the occasion and sharing your opinions today. I cordially thank each and everyone for making this session more successful with your presence. Thank you, sir.
Thank you.
So please accept our certificate. We will send it to your mails.
Thank you. Thank you. Thanks a lot. And have a good day to all of you.
Thank you, sir. Dear participants, please fill the feedback forms provided to your emails. The certificates will be sent to your mails.